and you guys. It's recording. 1, 2, 3, 4, 5, 6. Is it? Let me see. Okay. Okay, make sure it's at a good spot. My name is Rhonda Newman, and this is my last speech. Uh-oh. My persuasive speech. Is that good? Okay, today's speech is on why infants and children should be vaccinated. Because preventing the spread of disease in infants and children through proper vaccination is very important in today's society. The American Academy of Pediatrics has found that vaccinations have reduced the number in infections from vaccine-preventable diseases by more than 90%. How do you protect your newborn infant and your and your new adopted child? You may update your home with safety gates or install a car seat in your vehicle, or even buy baby video monitors to go into their room to ensure your child's safety. But one of the most effective ways to protect your child is to have them vaccinated. With modern medical advances, scientists have been able to protect children from more diseases through vaccinations. One such disease, such as polio, which many people feared many years ago, had disappeared with no reports in the United States. So now there are no signs of polio in the United States. There are more than 16 diseases that can be cured by having your child properly immunized. Some of the other diseases that are included in that would be measles, HPV, which is the human papilloma virus that relates to cancer, and these are all things that are stated by the Center of Disease Control. Today, you will learn why vaccinations are crucial in protecting your child and your young, and some of the risks that are associated to choosing to not having your child vaccinated. I understand that some parents may be very skeptical about having their infant or child vaccinated, but it's important to know that hundreds of scientists, healthcare professionals, and doctors have reviewed these vaccines before your child even gets it. It's also just as important to understand that while there may be a momentary discomfort to your child, that some discomfort is much better than your child having the full-blown disease that they need to be vaccinated for, such as mumps or tetanus. When visiting your pediatrician for well child visits or physical exams, be sure to use your pediatrician as a tool to help you navigate through any questions or concerns that you may have about the vaccinations at that time. Each state is different, so you need to know your immunization schedule. The Mississippi State Department of Health does provide a schedule of how they would like children vaccinated from birth through 18 months. And there are some vaccinations that will go through and exceed up to 18 years of age. Some immunizations do have multiple doses, as you can see. So it's very important to keep up with your child's scheduled appointments with their pediatrician and with the schedule that is listed for your state. Multiple immunizations are safe, and delaying immunizations can be detrimental to your child. Receiving one single dose or multiple immunizations at one time does not burden your body's immune system. And we need our body's natural reaction to the immunization to create a protection against the disease that the vaccine is going to give you. The Mississippi Department of Health also warns parents of delaying children's immunizations later than scheduled, as it only exposes your child and puts them at more risk to the infectious disease. Some parents may choose to delay or negate vaccines, which may expose their child to the life-threatening diseases. But if exposed to things like measles, polio, mumps, and varicella, symptoms such as hearing loss, spinal cord damage, or destroyed nerves, or even infections in your saliva gland or brain damage could occur. In addition to these devastating symptoms, here are some of the risks and concerns to think about if you decide not to vaccinate. Make sure that you have an understanding about these diseases and how they spread. A good example would be measles. It is a very contagious disease that even if an unvaccinated person, it's a very contagious disease. If an unvaccinated person can get measles just by entering a room that an infected person just left out of. In this graph that I have here for measles, it shows the spread of how measles has decreased in the United States from 1950 to the 1990s. Understand that your child's school and your child care facilities may not allow your child to enroll until they have their proper vaccinations. Sorry, I got a little lost. Okay. But if you choose not to have your child vaccinated, it is your responsibility to inform any type of medical staff that your child has not been properly vaccinated so that a doctor and medical professionals can treat your child accordingly. And in very rare cases, children with deficient immune systems or low immune systems with unique healthcare problems may not have the same schedule as most children. So it's very important that you have your child that may be healthy vaccinated in order to prevent a child that does not have the best health from obtaining any type of disease. So, with all that said, in conclusion, vaccinations provide a high level of protection at a very low risk. They keep your child very healthy and ensure them a better quality of life. A quote that I have from Ezekiel Emanuel says, "Vaccines are the most cost-effective interventions there are. $1 spent on a childhood vaccination not only helps save a life, but greatly reduces spending on any future health care problems." Thank you. And I would like to thank all of my coworkers for always listening to my speeches that I forced them to listen to. And I'm very glad that this is my last speech. Thank you.